So, in chapter 2, we talked about inflammation and how the body responds, how it's a non-specific response that happens over and over again, the same way every time we have injury. Here in chapter 3, we'll be talking about immunity, the immune response, which we discussed as coming in later, and immunologic oral lesions. But before we do, let's talk about how chapter 2 and chapter 3 actually relate. So again, we talked about injury. So when someone is injured, the body responds the same way. It has 3 main responses to injury. The first way is inflammation, the rapid response, the first line of defense. The second response is immunity, and that involves memory. That's the one we discussed as coming in later on. And the third way the body responds is with repair, and that has to take place as destructive agents are removed, but the body can't repair itself fully until all the destructive agents are removed. So that's why number 1 and number 3, or inflammation and repair, came together in chapter 2. So now let's talk a little bit more, though, about immunity, because that's what we're focusing on here in chapter 3. So when we discuss immunity, we're actually talking about a portion of the immune response. Okay, so immunity involves memory, and it's highly adaptive. So let's get you started with a quick review. So in our immune response, and we've got our little person over here who's been injured, and naturally we expect that some bacteria has entered the wound. You know, even with a very minor nick, you can have millions of particles of bacteria entering the body. So we have our initial and rapid response, our innate immune response. So we want to think of our innate responses as being our non-specific defenses, right? So those are the ones that are going to happen all of the time. All of them are already in place. So for example, our skin, and we just use skin as like the initial representative of outer barriers, but we could be talking about things like our tears, the cilia in our nostrils or bronchi, and mucus, things like that that are flushing, protective barriers. As bacteria gets in, though, inflammation, the same process, takes place over and over again. And this is when the inflammatory response comes in, and we talked about it causing pyrogens and fever being something that the body can use to destroy bacteria. So as time progresses, we come along in our timeline, and we come toward now our acquired responses when we come to our immune response. And this is the section that we're talking about in chapter 3. Acquired immunity, specific defenses. And that is broken into 2 portions, which we will get into. So just a quick overview of the things discussed. We'll be talking about the acquired immune response. Antigens, I'm sure you've heard of that term before. We'll talk about antigens and antibodies, but antigens, what are they? We'll get into those specific cells that are involved in the immune response. Back in chapter 2, we focused mainly on our neutrophils and our monocytes, which become the macrophages. So here we're going to be talking about which cells are involved in the immune response. And then within the immune response, we have 2 major divisions. We've got our humoral and our cell-mediated divisions that we talked about. And in this chapter, we're going to be discussing those a bit further. So we'll get into the difference between active and passive immunity, and you'll see that within this chapter. And immunopathology, we talked about how diseases can be caused by malfunctioning in the immune system, and then also the oral immunologic lesions and diseases. So lesions related to the action of the immune system's function, or those lesions whose pathology is related to the actions of someone's own immune system.